Hello and welcome to the Hooked on Health podcast. I am your host, Dr. Sean Lordan, and with me today is Erin Guarnieri, nurse practitioner to the stars.
Thank you very much. I'm happy to be here today.
Yeah, and welcome. And tell us a little bit about yourself and your practice, Erin.
So I am a nurse practitioner that started out in the primary care space and segued into aesthetics and wellness. When COVID hit, it was, I think, a little hard to take for a lot of practitioners. And there was some heavy duty stuff that I wasn't anticipating. Weird, rare cancers that we were seeing out of nowhere. And it was a little heavy to take home day after day after day. And I said, well, is this what I really want to do? Or do I want to do more of what I'm good at and help people feel good, look good, and deal with their physical issues? So that's kind of how I segued into opening my own practice. And the other practice was on the South Shore. Now I'm a little bit closer to home in Westboro, so that's a phenomenal option. And I still have my clients out there too. So
that's awesome.
It's a good thing. Yeah.
Now let's hit rewind. We've known each other for a long time.
Yep.
Tell the audience your full story.
So full story, I was not in medicine, right? So I
undergrad at Harvard.
Undergrad at Harvard, loved it. Amazing experience. Went on to become an entrepreneur, opened several different businesses. The one most recently before getting into medicine was a bakery that specialized in dietary restrictive options for people. Yeah. So I'd supply everything from American Girl doll with their specialty cakes to wedding cakes and local bakeries. And it was fun, but then I got to the point where I either had to expand or help keep causing diabetes or help fix it and treat it, right? So treat it went out. And then I became an RN through a post-bac program at Mass College of Pharmacy and Health Science. And then I worked at Care Tenders VNA for years. And that's where I worked with you. Yeah. And then I got to the point where I said, this is interesting. Every time I've see an issue come up in the field, and I'd call doctor's office and say, yep, this is what we need. This is what's going on. And they didn't heed my advice. Then exactly what I said would happen. And too many people and too many clients would come to me and say, you really need to go and become a doctor or become an NP. And initially I thought, yeah, that sounds great. Am I ready for that? And my kids were young at the time. And I said, no, I think I'm going to do it. And I haven't looked back and regretted it a single day. Love it.
Yeah, that's awesome. What do you think was you talked about patients, obviously patients wanted you to go back and, really be their provider of choice, which speaks to a level of trust, right? What else kind of sparked you to start this business in particular?
So I saw a lot of issues within primary care, right? You became a situation, depending on where you were working, it was a numbers game. Mm-hmm. It was how many patients are you seeing a day, rapid fire. What you were expected to do as a provider just kept adding for responsibilities, but what you were able to give your patients was smaller and smaller and smaller. And you often had this feeling that they were leaving without all of their needs met, but you don't have any more time, right? So you're doing an annual physical for a person. You're supposed to be able to address whatever issues that they're having. And instead it was, I'm going to need you to come back for a follow-up visit, or let's arrange for a telehealth to get on X, Y, and Z and fix these other issues. Yeah. So it was kind of a natural segue for me to say, I've got to fix something in this, whether it's the way I'm practicing or where I'm practicing. Yeah. So where I'm practicing won out. And now I have a very small list of patients I do concierge work for, and it's great.
That's amazing. The medical guided weight loss. Let's talk about that. So what's the difference between medical guided, just for the audience, what's the difference between medical guided weight loss and just traditional weight loss paths?
So I think pre-GLP-1s, pre-injectable options, it was more about calories in, calories out. Here's your weight loss plan. Here's your exercise plan, right? That was the crux of it. Mm-hmm. Then once medical guided weight loss started to become more and more popular, when we had these medication options on the market, whether you were using different things off label, right? So initially, Ozempic was used off label as a weight loss drug. So that came out in like 2017, FDA approved. And people were shortly after using it off label because we recognized, you're going to drop anywhere from 6 to 12 pounds without doing anything. How amazing is that? Well, not so much. So the medical guided part comes with, it's not just here's your medication, right? You can go online, pick any number of the plethora of options that are out there and say, let me get this, let me try this medication and do it. It's almost everyone that does that is going to succeed a little bit because you're going to have the effects of the medication, but ultimately you're going to fail because you haven't changed anything about your diet and lifestyle, right? It's garbage in, garbage out still. So you can't expect this to be a miracle drug that's going to fix all your issues. And that's where my program in particular changes things up. I recognized very early on that people were coming in, they drop weight, they look smaller, but not better, not healthier. That's where you hear all about, now they call it Ozempic face, right? Or you look like you're a smaller version of yourself, but not stronger, not leaner, not healthier. Your skin color is discolored, often from malnutrition. Your muscle tone is in the trash can because you haven't done anything to exercise. And then you lead all these other issues that are then coming into play because you haven't fixed anything.
Yeah.
So that's where my program differs than even a lot of the other programs out there, where I pull in a huge component of the nutrition and the activity along with the medication. So it's a little bit different. But that's the biggest issue is are you following just a calories in, calories out? Are you incorporating the new medications, and can you do it without them? The answer is yes. You could still do it without them. Yeah. And I still have a lot of patients that can't go on the medications and do it without it. So there's a fine line to cross, right? And a big decision to make of how you want to approach it. But that's why it's individualized. It's personalized to whoever's in front of you, you know?
Yeah.
It's not a cookie cutter program.
And I think that's, when we talk about weight loss, and I think about Ozempic, and, we've had, board certified, obesity docs on the podcast, and they describe it like the Ozempic or the GLP-1s as, not necessarily a vaccine that's preventative, but really like an antibiotic that's treating the disease when it's active, right? And obesity is an epidemic. It's affecting, I don't even know what the percentages are, but it's got to be 70% plus the United States is obese.
Yep.
And I guess as part of your practice, because you're really, you pull in, natural wellness, and you do aesthetic treatments as well.
Yep.
And I feel like you have the time to be holistic with people as well and look at the whole picture.
100%.
So talk to me about the weight loss as part of that, and then kind of work in, the aesthetic piece that you do too, because that's really cool, and the audience should hear about that.
So I think the holistic part of it is a huge component of it, right? What did it take for someone to get fat in the first place, right? There's so many different factors, from environment to not knowing any better. There's, a knowledge deficit of what am I supposed to eat? How many calories am I supposed to be at a day? What's my activity level? I think that a big issue, especially within the US, is people have fad dieted and done things of whatever the weight loss trend is for so long. They've been unable to recognize what their metabolic baseline is. And they lose an understanding of what you're putting in your body is just as significant as what you're not putting in your body. And a lot of people use these weight loss programs as a way to get rich quick, right? Let's fix the fat problem, but without fixing the underlying crux and cause of what's gotten them to that point in the first place. So a lot of my conversations back and forth with patients will be like, what's going on? Tell me about you. Tell me about what's going on, because we've got to fix more than just your dietary intake here. If I don't change your psychological way of how you view food and your relationship with food, or how you view activity and exercise, in particular muscle building, we're not going to be successful. Your long-term success rate isn't going to be there. I'm after looking at where's the best way for us to give you more longevity. That's the ultimate goal, right? Yeah. It's not just about losing the weight. It's not about eating the right thing. It's not about doing the right exercise program. It's a happy marriage of all of those things together, but individualized to you to say, okay, well, you know what? You can't do this because you've got a knee issue, or you can't do this because you've got MS and you fall frequently, but let's work with what you can do. Let's bring in resistance bands. Let's bring in nutrition as the source of fueling your body as food. And there is a psychological play at this. And it's hard. I've had a lifelong weight issue my entire life. In the past 3.5 years, I've lost 100 pounds. I've gone up and down the Richter scale of weight my entire life. Yeah. This is the first time I've been able to not only get weight off, but keep it off. Yeah. So I understand this program as a provider and as a patient.
Yeah.
And it gives me a different perspective than a lot of the other providers out there, because I recognize that all of those components, if we're not addressing them through holistic measures, and it's also what are you bringing to the table on this, right?
Yeah.
I can lead a horse to water, but I can't make them drink. So if I explain to my clients why I'm having them do certain things, and I say, look, you know what? I need you to be doing the weightlifting. And for women, I don't know what it is. There's this like mental block on it, right? I don't want to lift weights. I don't want to get to look like Arnold Schwarzenegger. And I'm sitting there going, okay, no, that's never going to happen. I could tell by what got you here in the first place. You're never going to look like
progressive overload isn't in the equation.
Exactly.
Yeah.
So it's about meeting them in a realistic place where it's, are you ready to address your issues? Are you really ready for change? Because change is painful.
Yeah.
Change is uncomfortable because it's the unknown. And then what if you succeed? What are you falling back on as that mental excuse, right? It's about no excuses. It's about let's bring it and let's do what we can to help you succeed healthfully.
Yeah.
And bringing all those things in from nutrition, from supplements. And I mean, there's so many things on the market now. It's difficult for the average person to differentiate between what's a trend and what is the best holistic approach to everything from weight loss to nutrition to supplements, right? Most women, when I say, I want you to go and get some creatine monohydrate and start that every day, and they go, I'm only going to take it when I'm weightlifting.
Can I tell you, I got fired from my high school job for selling creatine monohydrate to a female who literally wanted it. She bought it. My boss found out 2 hours later, and he's like, you sold creatine to a female? You're fired. Like literally, I was 17 years old, by the way. And I love it. It put me in supplements. I knew nothing about supplements, for the record. But how far that's come.
Yeah.
Right. You know.
But it's trying to differentiate between what's the latest fad, what's got the science behind it, and what's going to be good for you. Just because it's good for the masses doesn't mean that it's going to be good for you, right? I'm going to look at different things on your profile and say, okay, let's look at your labs. How's your kidney function? Are you staying hydrated? Are you getting in the proper nutrition that you need? And if you're not, what can we do to fix this? Do I need to give you a specific menu plan based on foods that you will eat? I have some very picky eaters. And I had one lady that came and she was like, all I eat is chicken and celery. And you're sitting there going, I doubt that that's all you're consuming. This is beyond massive metabolic issue if that's the case, right? That didn't get you to be 365 pounds.
Right.
We need to figure out, was it fried chicken and fried celery covered in peanut butter? What's going on? Like there's factors that if I don't know as a provider what is really going on, I can't help you. And that's across the board, right? Whether it's primary care, aesthetics, wellness, doesn't matter. If you're not being totally honest with me, I can't fix the issue.
Well, it's the alcoholic that goes into the one time a year doctor's visit with their PCP and says, I have 5 drinks a week.
Yes,
it's like
exactly.
people don't want to be embarrassed.
Yep.
When and we see it all the time in PTs, like when they're sharing their past medical history, there's a lot that folks omit because they don't think that it's going to affect, their shoulder rehab or their knee rehab, when in reality, a lot of things affect healing.
Yep.
We know that smoking doubles healing timeframes.
It does.
So that's, it's an interesting perspective when you do an intake, weeding through and then asking the right questions and having the time to really dig in,
100%.
Tell me more about the aesthetic piece and how you tie that in.
So it's funny because how someone views how they are and what they feel their best features are, what their personal hangups are, right? So I can have someone come into my office and I look at them and I'm going, I know they're here for an aesthetic consult. I don't know what, they look fantastic, right? And you're sitting there going, well, what do you want done? And it's, I want my lips bigger, or I want my cheeks to be more defined, or I need you to get rid of this extra chin, or, I'm looking at, all this stuff online and I think I need something, but I don't know what. And those are the scariest people because you're sitting there saying,
here's the psychology. Yeah.
What do we like about the way you look versus what don't you, right? So it's kind of a fun way to get in and look at someone and say, okay, where's your natural beauty, right? Let's highlight what makes you feel the best about yourself. So whether we're doing neurotoxins like Botox and, Daxify and Xeomin, or we're using fillers, whether it's a regular filler or a natural filler like PRP, it's often this very tricky road to kind of go down, and have people really look internally to see what do I really want fixed versus what do I feel like I have to fix based on current trends. I'm not the person to go to if you want the duck lips. I'm going to say no every single time, turn you on, and I could tell you who to go to. But it's about creating natural, enhanced beauty that you don't want to look like somebody else. The minute you start looking like somebody else, you probably should have stopped 5 treatments ago.
Yeah.
And, even a lot of the other injectors I know, they'll go for, oh, I have to do a full syringe and I have to go here. It's no, you don't have to do anything. You should be reassessing as whatever you're doing and saying, is this the right fit for this client? What are they asking for? Can I provide it? Can I give them the results that they expect? And what is the end result going to look like something I'm proud of having you walk out look like, right? I mean, it's...
It's funny, Erin. I've never gotten over the irony in I've never gotten over the irony of Botox injections, which is literally botulinum. It's a toxin, neurotoxin, and overall health and wellness. I think that there's such a juxtaposition between like creating this holistic, healthy plan and then shooting you up with neurotoxin.
Yeah.
But the other side of that I see is how people feel, the emotionality behind it. So can you talk about that a little bit in the big picture?
I think the amount of people is astounding that you walk in, they seem very put together, right? And then you do whatever it is that they're asking for, whether you're fixing the smoker's lines from not even smoking, right? This is like the water bottle craze, the straw phase. People are getting wrinkles everywhere. I have so many women that come in, they come in, I do the treatments, whether it's with filler or PRF, fix this, they're sobbing. They're like, this is life-changing. And you're sitting there going, it's a wrinkle. It's like, okay. And you recognize emotionally how inhibiting it is in their own heads and how they're holding themselves back from doing things that they want to do, or just the emotional fulfillment of feeling like the best version of yourself. And when they get that again, it's life-changing. It's pretty special, right? Like to be able to have the power to do that, but every provider that has the power to do that also has the power to make it go the other direction. So you need to make sure that who you're going to is appropriate, that it's within their specific skill set, because you don't want to wind up with something in your body or done to you that's not contributing to emotional wellness, Yeah,
and I'm sure plenty of people have seen the horror stories with improper Botox injection, hitting nerves potentially, or just like too much, too little.
Yep. Or placement that you can arch somebody's brows and they're stuck like that until it wears off. It's a very surprised look for
just
quite
constantly
a few months.
Curious. Yeah.
They're constantly very surprised. So
what keeps you going on a daily basis? What keeps you excited about what you're doing day to day?
I think I try to stay on top of regenerative medicine in a way that is less harmful. So constantly staying abreast of, if I'm, I just got certified in doing O shots, P shots, vampire facelift, breast lift, facials, because it's bringing something forward to people to help fix a broken part of their lives, right? Mm-hmm. So if you've got a physical issue, whether it's impotence or incontinence, or I can't tell you how many women in that postmenopausal phase that come to me and they say, oh, I love my husband. I think they're such a great human. I feel like I'm taking one for the team every week. Mm-hmm. And you're sitting there going, okay, sexual function is a huge part of relationships and marriages with partnerships, right? So to be able to fix something like that by doing a PRP injection in the right way, or whether it's, in the penis or in the vaginal vault, or you're helping someone sexual wellness and being, or physical wellness and being by giving them a new lease on their own security and confidence. That's what drives me. It's you're making someone's life better and fixing issues that they need fixed. And you're using your knowledge and expertise to be able to do that. And I think it's a gift, right? I think that not all providers are created equal. When you go to the right provider and you get the right treatment, what's better than that? You're helping people achieve their ultimate level of health and wellness. That's a gift.
100%. And I think a lot of people, especially when it comes to like sexual health, people don't talk about it.
No.
You're not asked at a primary care level, right? It's just,
not anymore.
That's not even a question.
Nope.
You're not even, I don't even have at a physical, my primary care doesn't even touch me. Like it's not even a physical. So I mean, maybe they're not doing manual muscle testing. I'll tell you that much. They never have. But I mean, maybe you might get a little abdominal testing and they test the quadrants, but that's pretty much it. I mean, they don't do any sort of like, it's just an interesting.
It's changed, I feel like, a lot since COVID, right?
Yeah.
When we all of a sudden had all these telehealth visits come into the play where you suddenly didn't have to see someone to treat them.
Right.
And it's doing many people a disservice. And the amount of times I've had someone come in and say, oh, you're the first, countless times, you're the first provider that's touched me for a physical in over a decade.
Yeah.
To me, that's disgusting. It's like, why else are you there? Because just by looking at you, I could see that, your skin's great, you're looking healthy, your tissue perfusion's fantastic, Sean.
Yeah.
But does that tell me what your heart's doing? No. Does it tell me anything about what's going on inside? Does it tell me about masses that I could feel and should be able to feel if I palpated? No, it doesn't, right? So it's trying to bridge that connection and say, and ask and be like, you're not even going to check my thyroid. You're not even going to check my abdomen. You're not.
And even still, if you don't even get the blood work prior to the visit, they literally have nothing to work off of.
Yes.
And then you're just working on the back end, going back and forth in my chart.
Yep.
Like, oh, hey, here's your blood. Your cholesterol's a little high. Here's a cholesterol med. It's like,
yep.
All right, well, I would have loved to have talked to you about that for 5 minutes while I was in the appointment. Like, what can we do? Like, what are some I can Google it, but that's literally that's your job.
It is. Well, and that's it. And I feel like if you don't know, you're in trouble. Right? Yeah. You have to be your own advocate when it comes to your healthcare. You have to be the one driving, not the provider. It has to be, these are my concerns. This is what's going on. This would make me whole. This would make me feel better. I need to get rid of this pain, and everybody comes in and you're like, oh, my back hurts. This hurts. Well, why does it hurt? What's going on? Let's do therapy. Let's explore options to get you to fix the problem before it becomes something bigger. And I feel like that's a disconnect with a lot of patients and providers. And because good luck finding a provider now, right?
Yeah,
you go and you're trying to find, it's more like, are you accepting new patients? Yeah. It's not, can I see so-and-so, because you can't even get in to see them if they're good most of the time. And that's created this whole concierge medicine trend, right? Where people have insurance and they're paying out of pocket to be able to see providers that they trust to be able to fill that gap, right? And say, I want to make sure I have access to someone that can help me when I need it. My kid has an ear infection in the middle of the night. I don't want to be going to the ER. Yeah. Or I am in a situation where I'm having intense pain. Is this something that I, can assume is gas? Or is this something like appendicitis or a gallbladder attack? Do I need to look further? Do I need to go get seen? Or can I see you? There's a lot of disconnects in our medical system right now.
So let's talk about your model, right? So how can patients work with you? What is it? Walk me through a new patient joining your practice.
Okay, so new patient joining my practice, we're going to go a healthy deep dive into medical history, figure what's going on, right? What is your baseline? Mm-hmm. If I don't know where your baseline is, I'm going to have a hell of a time getting you back there if something's off, right? Yeah. So what's your baseline? What do you do? What do you like to do? What's your activity level? What are your health goals? That's an important part of a provider conversation. If I know where you're going, I can help put a plan together to be able to help you get there. If it's weight loss, we'll talk about weight loss medications. We'll talk about being on them, being off of them. What are pros and cons? If it's about doing aesthetic treatments, what are the pros and cons? Not everybody is going to be acceptable for all treatments, right? You might have different disease processes. You might have autoimmune disease like MS, right? That often doesn't even get discussed when you go in. But I need to know about those things before I'm doing any kind of an injection. What other medications are you on? Maybe what I'm putting in is not necessarily good for you. So it's important as a new patient for me to get full medical background, figure out what your goals are and how I can help you. Just because I'm a provider doesn't mean that I'm necessarily the best fit for you or you're the best fit for me. I have some people that come in and what they're expecting is impossible. You're sitting there they're saying, I want these humongous lips and they've got pencil thin lips that are only going to hold a certain amount of volume for filler, right? Yeah. So I could pump all day, but I know that it's not going to stay in your oral tissue. It's going to be migrating out here and you're going to look like a clown before, the month is out because it's not good for you.
Yeah.
So finding a provider that's going to listen to you and do that and be a good match on both sides is half the battle. And I pride myself in being able to be open and honest. If I have a patient come in and I feel like there's someone better for them for what they're looking for, I'm happy to refer out. And same comes back. It's a situation where it's that honesty, it's that trust. Communication is the key for everything. And just be honest, I can help you by doing this. Does this help you? And then feedback. And it's that back and forth. It's not, I'm saying this as your provider, end of story. So we do medical history. We go over their goals. I tell them how I think I could most appropriately help them or how it would fit. And then we form a plan that we're both agreeing on to be able to get there.
Who is your perfect patient?
Someone that's open to suggestion and then is able to follow through, right? Someone that can come in and say, look, this is what I want done. This is why. Or these are my problems. Can you fix them? Mm-hmm. The answer is going to be yes or no, right? Yes, I have these medication options. I have these physical things I'd like you to do. Optimal patient will say, perfect. I'm going to do those, pelvic floor exercises, and I'm going to concentrate on making sure I'm staying hydrated, and I'm going to make sure that I'm getting the nutrition in. It's someone that's going to look at what you're saying, but then comply.
Yeah. But then you're giving them the action steps so that it's not do all these 10 things. Here you go. See you in a month.
And there's a feedback back and forth, and it's not always see you in a month, right? I have some people that I'm like, I want to talk to you tomorrow. Yeah. I want to talk to you after your first day of this. Tell me how it's going and if there's anything we need to tweak. I don't want you to wait a month to figure out that, the medication didn't help. You didn't take it because you didn't like the metallic taste in your mouth, or you didn't like it because it gave you a headache, or you only took it sometimes, but then you took it incorrectly, right? So having that constant feedback helps me be able to treat you better and you to get better results. That's bottom line that we're looking for. It's a win-win.
I want to talk about the pelvic health piece, the sexual health piece. That's something that I feel like in medicine is just sort of like not talked about. And I think that people just live with problems. They don't know that there's solutions to. Especially
females, I have to say, men are, everybody knows about the little blue pill, right? What are we going to do? Oh, we're going to try this, or we're going to try this light therapy, or we're going to try, now there's so much we can do with regenerative medicine. PRP it's been used in ortho for decades, right? Let's repair the tendons, the ligaments, the muscle healing. You can use that in the vaginal vault to recreate the collagen, the elastin, the elasticity. You can help with lubrication. You can help improve their level of libido. For a lot of women, they just assumed it's long gone. And it's not necessarily long gone. It's just that your body has gone through hormonal changes from childbirth and perimenopause, menopause. It's terrible. And, then you have society saying, oh, well, you need to look a certain way, do a certain thing. And then they're looking in the mirror going, great, now I need to get, my crow's feet taken care of, and I need to get liposuction, and I need to get this done for this. And I feel like an old hag, and it, gets into this perpetual. Yeah. So to be able to treat people at the crux of the root cause and be able to give them the power to get back healthy parts of their lives, but especially sexually, it's such a human emotional connection, right? Sure. To be able to be with your partner on an intimate level is a gift. And to be able to do that without an issue is amazing. Mm-hmm. But so many people are embarrassed to talk about it to their providers. They don't know what options there are. And for women, up until now, it's been very minimal for options that they have. A couple of years back, Alessi came out, the female injection that you'd have to do before any kind of sexual activity, and it would help improve your libido. Now with PRP, even with use of Botox in the right places can help so much, And same thing for men. You can do PRP injections into the penis in very specific ways that is going to help rejuvenate and improve the tissue perfusion in that area and help with the impotence and help you feel like a better, more significant person in the bedroom because you know what you're going to perform. It's for men, you tend to need more treatments. For women, you could see a huge huge improvement after one treatment, and they might not need any more. Yeah. And it's just, it's gift giving, you're helping lots of people stay married.
Yeah, no kidding.
So yeah, but it's nice. It's nice to be able to have options now where you didn't before.
It's funny. I think about shockwave, and there's a big use of shockwave for erectile dysfunction.
Yeah.
And a men's health, I think there's Game Day Men's Health and all these different clinics that I think about doing shockwave and how much it hurts on my elbow.
Yep.
And for the record, we don't push it here at Concierge PT for men's health. But for the right cases, we would do it if there are certifications in place for the provider. But I think that's also another piece is that Erin is certified, to be able to do this, in this manner. And it's not just any physician can do these injections. This is something that Erin is specialized in. You want someone that knows what they're doing, that has the training, that, and here's the thing. We can do all these things. Do we have 100% guarantee that it's going to work for you? No. Which is why for that stuff, it's money back guaranteed. If this procedure doesn't work for you, I'm not going to keep your money. I want satisfied customers, right? For those in particular. Yeah. It's such a difficult thing to come to terms with, that you need the help in that area. And then to be able to get it is life-changing. And then to feel stupid if you spent whatever how much does it cost, like an injection? So for the P shot, you're dealing with a $1,200 cost. Yeah. Because you're using PRP, right? So you're drawing someone's labs in PRP approved devices, which are totally sterile. You're spinning their blood down, pulling off the PRP, and then using that as an injection point. You're going to numb them first. We're not cruel here. We're not going to. But there's a lot of cost. There's a lot of cost on the provider end too. And why doesn't insurance cover these procedures? That's a really good question. And I think that there's a lot of red tape involved in that. And I also think it's such a new treatment available, right? That enough people haven't demanded coverage for things yet. So, but it's like the same thing with the weight loss drugs. Why isn't that a part of everybody's plan? That could be just as life-changing as amoxicillin, right? Yeah. But it's not covered for most people. And I think it's coming out now that some of these weight loss drugs are really they're sinking smaller insurance companies. The cost of the Ozempics and, because everybody, I shouldn't say everybody, but a lot of the population could benefit from them. Yeah. But to your exact point, we get a lot of referrals for patients who've just been put on Ozempic to continue to work, basically to strengthen their muscle tissue because obviously the muscular, it's an organ, so you need to make sure that you're strong and continue to, especially if you're older. Yep. We know that quads and, glutes are tied to longevity, like muscle strength and quads and glutes specifically. And the same thing in forearms. We know that grip strength is tied to longevity. And conversely, mortality, if you don't have a strong grip or strong quads, you can't lift things up and you can't walk, right? So those are things that are tied to mortality. Very much so. Or an increased risk of mortality. So the insurance piece drives me nuts, and I'm sure we could talk about that off the camera because it doesn't cover shockwave either. And these are technologies that have been around since the 80s. Yeah. They should be covered. They should be covered, but they're not. It works, yet, other modalities that have sort of been sunsetted, or sunset, are still ultrasound and e-stim are still paid for, so I think that's a separate conversation, but interesting. It's going to be an interesting thing to see what happens over the next year or so in the whole medical weight loss. Now you're getting into so many things, so many different peptides are coming out and so many different things are coming on the market, right? Anything utilized appropriately, you're going to see a change, right? The question is, what are the risks associated with that? And the hard part is a lot of this stuff, we don't know long-term effects because they haven't been around long enough to know what the long-term effects are, right? So you're taking a risk by doing it, but then you could be taking a risk by not doing it, right? You look at NAD+. That's the one thing that people are like, this is the fountain of youth. Get this injection. It's fantastic. It is great unless you have, rogue cancer cells that are going to be what's multiplying, right? So having people that are going through the right process to make sure that they've heeded all the guidelines for, have you gone for a mammogram? Have you
gotten an exam. What's going on? If I know that you're safe going into this, then we could potentially push that pause button with different things. But I can't if we don't know that you're up to date.
Yeah, we need to know what's going on.
For sure.
One clear message that our audience can take away today from this podcast. What's one thing you'd want to share?
I think if you're going in terms of medical weight loss, the singular most important thing I could say is build the lean muscle. If you're not willing to build the lean muscle, then you're doing yourself a disservice. End of story. Regardless of age, regardless of gender, build the lean muscle.
So it's work. For the audience, it's still work. You've got to have a plan. Yep. It's not just a magic pill where you lose a bunch of weight. Because you'll look like an entirely different person and your quality of life will suffer.
Absolutely.
Because you won't have the energy. And then it kills your metabolism too, right? Because your muscle.
And my biggest concern for a lot of patients coming on this is, especially if you're an aging woman, right? You're already at risk for osteopenia, osteoporosis. Now we're going to take away your muscle density. Well, guess what? We just bought you a fast track ticket to, right? Yeah. Like we're doing you a disservice by just blindly entering into different options. So it's really important, I think, to look at it from a perspective of, if you're going to make the choice to go on a medication, then be willing to put in the work, because the benefits that you're going to reap are going to be so much more substantial, right? Yeah. You're going to be able to have long-term success. Most of my weight loss patients have been able to not only hit their goal, they'll usually pass it and then be able to maintain it off of the medication, which doesn't usually happen. Most people, once they're off of the medication, they start gaining the weight back because your pancreas isn't producing as high a quality level of insulin, right? It's not as utilizable. Your food noise comes roaring back because we're not quieting that. And then their bowels are all screwed up because they've gone from slow motility to back to normal. So it's a choice. It's all a choice. But you should be seeing someone that can help guide you so that it is affecting your longevity and you are setting yourself up for long-term health and success. And that's what it's all about. It's about making yourself better, right? Nobody wants to wake up and be like, I want to lose this weight and then get better. It doesn't happen, right. But if they're not willing to take those steps, that's exactly what happens, because then they lose the muscle and it's not worth it. Yeah,
that's a tough. And I know many of our audience much of our audience doesn't want to be on a medication for a long period of time.
Yep.
They want to be able to cycle off of
absolutely
an Ozempic or a GLP-1 and not take it for the rest of their lives.
Yep.
So I think it's an important distinction to note that you work with people throughout that plan. So it's not just like, hey, here's this med.
Yeah.
Here's a personal trainer or here's a script to PT. Good luck. We'll see in a year.
Yeah, no. And I have to say, most people that are the most successful communicate with me on a weekly basis. It's it's that touch point, right? Same thing as that Weight Watchers mentality of like, let's get you on the scale. If you've got someone that's holding you accountable for your actions, you're more apt to follow that. Right. So it's like, oh, shoot, I've got a doctor's appointment. Oh, no, it's, 2 weeks away. I need to concentrate on my fiber and my water intake and stay away from the wine and, do all this stuff. And then your results are not your real results.
For me, it's Blue Score pizza. It's so good. Oh, my God.
That is good. Yeah.
Rapid fire.
Go ahead.
All right. Favorite morning ritual.
Vibration board.
Really? What is that?
It's a board that is about this big that has different places you put your feet. Plug it in and it vibrates like crazy, but you get one hell of a squat for 15 minutes. And it keeps you have to maintain your stability or you're going to fall off. And it has, I have resistance bands that I attach to it. So I do it right before my coffee every morning.
Oh, that's cool.
So
does Mike do it too?
He just laughs at me and keeps walking.
Sounds about right. For the listeners, her husband Mike is a physical therapist. So
yep.
That's awesome. Your go-to healthy snack?
Watermelon with feta, blueberries, and mint.
Yeah, that sounds amazing.
Yeah.
What's really good with that too is balsamic vinaigrette.
Mm-hmm.
Something about your patients that you might find surprising.
Something my patients might find surprising, or something I find surprising about my patients?
Something you find surprising about your patients.
The amount of things they hold back for fear of embarrassment. Because as a provider, I don't judge you. right? I'm sitting there. I mean, I'll judge it in the sense of how can I fix this, right? Your quirks and your personal history is your personal history. It's part of what got you to where you are. So I can't fix things or change things unless I know what's going on. Most surprising, I think, is what they hold back or don't say. And then you see a whole different picture. I had one physician that I had a physical exam with one time that I was giving him the physical exam, buttoned up, looked as neat and put together as you could possibly imagine. Clothes off, tattoos every single possible way, and piercings in places that I wasn't even aware that people pierced.
It's crazy, huh?
So you just don't know what people are hiding, right? Like there's different aspects of people that can surprise you, but we're all human, you know? It's your goals are my goals. If we're working together, we're going to try to achieve those.
Yeah, I love that.
Yeah.
So where can people find you? Obviously, all of your details will be in the show notes. So email, contact information.
Yep.
How can people find you? How can people work with you?
So ErinGNP.com is the website. We're in the process of updating some of the pages with newer treatment options. I'm available for men's health, women's health, aesthetics, wellness, and a very small percentage of concierge patients.
That's awesome. That's
so,
great.
yeah.
Do you take some insurance for the...
Right now, no.
Okay.
So I was in a practice that I wasn't credentialed for individual billing.
Okay.
And now I'm in the process of getting credentialed. So eventually I will, but right now it's just cash based.
That's great. And what does it cost to work with you on a concierge basis?
So it varies depending on which plan you're looking for. Are you looking for round the clock option? Are you looking for physicals? I mean, I have people that don't have insurance that are just like, I need access to someone to do an annual physical, lab work, those are minimal. It's by, a la carte basically for those.
Great.
And then there's other plans too.
Awesome.
Yeah.
Well, thanks, Erin. Appreciate it.
Thanks for having me. This was fun.
This is great. Awesome.
Thank you.